Good afternoon. Thank you for joining us. As we approach this weekend, July 18th, which would be Saturday, I wanted to just put out there at the very outset, and you'll give some underlying evidence and support to why we are going to stay at stage 4.5 for at least the next 2 weeks as we look out and factor in everything that's happening. It's a very volatile environment out there, not just in our state, but surrounding our state, around the country, around the world. So we're going to lock in at 4.5, and we'll be here for, as I said, at least another 2 weeks. And with that, maybe you could give some of that supporting information on why we made that determination.
Absolutely. Thank you, Governor. Good afternoon, Hoosiers. I'd like to start today with some very frank discussion about where we are as a state with COVID-19. For the second week in a row, the number of positive cases has gone up. We've seen more than 4,300 new cases in just the past week. During the same 7-day period a month ago, we saw just over 3,000 new cases. And we are responding by consistently working to ramp up our testing capacity and sending strike teams to the most critical areas, for example. While we continue to increase our testing capacity, we are having to adapt to the supply and demand issues that have been created by the significant spikes that we've seen in other states across the country. This is similar to what we saw back in the spring and has impacted our ability to get some supplies. It has also increased the wait time for our lab results in many cases. We know residents are experiencing longer waits to get their test results and that they don't know what to do in the meantime. These are external factors that are beyond our control, and we have become skilled at adapting to them. Despite these challenges, we are able to expand our free testing this week with an additional 11 sites around the state. That's largely due to the work we've done to build up our own homegrown capacity. The 11 new sites will send specimens to Indiana labs that are part of the Indiana Lab Testing Network that we announced last month. Having Indiana samples processed by Indiana labs will help speed up the turnaround time for those results. We anticipate a 3 to 5 day turnaround for those results. And our strike teams are typically able to get results within 48 hours, meaning a quick response in our most critical areas where we need to avoid outbreaks, such as nursing homes or industrial facilities that are seeing high numbers of cases. But I want to ensure that we are able to sustain this. We'll still expect to see another surge of COVID cases this fall in tandem with flu season. This will increase the need for testing and supplies in all states, not just Indiana. So the work that we do now to keep our communities safe and ensure that our healthcare system has ample capacity will put us in a better position for the expected surge. Every Hoosier has a role to play in this effort. That means wearing your mask when you're in public and when you can't socially distance outside. It means staying home if you're sick. This is especially important if you've been tested for COVID and are awaiting results. If you've been exposed to a person with COVID and don't have symptoms, you still need to quarantine at home. And if you've been exposed, have symptoms, and think you're positive but are waiting for results, stay home and quarantine and then isolate if you come back positive. We also need Hoosiers to remember that things are going to look different in our schools, at church, and throughout our daily lives for the foreseeable future. We all have a responsibility to do our part in keeping our loved ones, our neighbors, and our friends safe, and we cannot relax our guard. I'm going to talk you through the data so that you can get a better idea of what we're talking about. Today, we reported 700 additional cases of COVID-19 in the state of Indiana, which brings us to a total of 53,370, the number of Hoosiers known to have COVID. Over the past week, our daily count of new cases has ranged from a low of 447 on July 12th to 763 on July 10th. We continue to see hotspots in northern Indiana, Marion County, and southwestern Indiana. We also saw 10 additional confirmed deaths. To date, 2,592 Hoosiers have died of COVID-19, and another 193 are believed to have died from this disease based on their clinical diagnosis. While our daily deaths have dropped significantly from the peak of 50 on April 22nd, any death is a terrible loss for a family, and it's something that we all want to continue to prevent. Our ICU bed and ventilator capacity are holding steady as a state with more than 35% of ICU beds and nearly 84% of ventilators still available. About 12% of occupied ICU beds are housing patients who either have been diagnosed with COVID or have symptoms of COVID. Less than 3% of our ventilators are being used by someone who has COVID or is suspected of having it. We also have seen more than 586,000 Hoosiers tested for COVID-19, up from nearly 536,000 a week ago. Since the Indiana State Department of Health began providing direct testing, nearly 1/3 of all tests reported to the state have been done by the Indiana State Department of Health staff or through our partnership with OptumServe. That equates to more than 182,000 Hoosiers. This is free testing open to any Hoosier. We currently have 35 Optum sites open around the state. Since May 6th, Optum has serviced and tested more than 102,000 Hoosiers. This reflects community testing and doesn't include our testing of staff or long-term care facilities, which I'll mention in a moment. As I said earlier, we're seeing longer turnaround times for results due to the national demand for testing. Since May 6th, the average turnaround time for OptumServe results has been just over 50 hours. The current 7-day average turnaround time is just under 59 hours. And we have seen some tests take as long as 80 hours due to increased volume nationally. Even if Optum's site appears full online, remember that they're still taking walk-ins beyond the maximum number of appointments. So I encourage Hoosiers to take advantage of these sites along with the 11 new ISDH testing sites we launched this week. I also want to provide an update on our testing of long-term care staff. In the month of June, nearly 45,000 staff at long-term care facilities were tested for COVID-19. We're still analyzing that data. We continue to work with long-term care facilities to identify outbreaks and send in strike teams to do testing. About 70% of facilities have submitted their historical COVID data, and we are working with the remaining 30% to get that information in so that we can start on the dashboard and list the cases and deaths by facility. We also have the latest data from our partners at Regenstrief regarding statewide hospitalization and recovery to share with you. Regenstrief has looked at over 51,434 cases this week. Of those, about 24% visited the emergency department, which is steady from last week. A total of 7,633 were hospitalized, which represents 15% of all positive cases. That's down slightly from last week. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing. That represents 3% of all positive patients. 74% of hospitalized patients have been discharged. Of the remaining 26%, 7% are believed to still be hospitalized. 19% are known to have died while hospitalized. Regenstrief also estimates that 76% of patients have recovered, which is down slightly from last week. While these numbers are holding steady, as I said at the beginning, I remain concerned about the number of overall COVID-19 infections. The 7-day average positivity rate in Indiana was 6.3% through July the 4th. That average has increased to 7.1% as of July 11th. For comparison, our lowest average positivity rate was on June the 18th, and that 7-day average was 4.2%. We also continue to see increased hospitalizations for COVID-19. On June 26, 595 individuals were hospitalized with COVID-19. Yesterday, that number was 881. We've also seen the daily admissions bounce back up. I want these increases to be a cautionary tale to every Hoosier to take steps to slow these numbers so that we can safely reopen our state. Thank you.
Thank you, Dr. Box. Rachel or Michelle, can we tee up a mask up video that we've got in the queue?
Kids love Rex the dinosaur, as you know, and so when kids enter the museum with their mask, they get a sticker of Rex the dinosaur wearing a mask. We have been slowly opening to members and neighborhood and donor members over the past few weeks. The expectations are high. And our staff absolutely want to be safe, and our volunteers as well. And we want our visitors to be safe. And of course, to kind of lead the way, we put masks on our dinosaurs outside. We've been just so heartened by how seriously everyone is taking wearing of the mask, even the little ones. It's been very heartening and wonderful.
Well, thank you very much for doing that. That just speaks to Dr. Box. You mentioned we've got to be as vigilant today, if not more so, by the way, than we were back in March.
Right.
And COVID-19 is not going away anytime soon. So it's really up to us to take responsibility for our own actions and the way that we conduct ourselves. So
It shows you that kids will wear their mask when they get to play too. So
and it can be done.
hopefully in school.
It can be done. We're seeing that all over the state of Indiana, and that may be why in comparison, maybe we're doing better than some others, but we're kind of living on the edge here day in and day out. And you see as this spread goes from one state to another. And again, that just a volatile environment out there that we see swirling all around us. We got to make sure that we're remaining calm and head down and doing what we can control. And those are physically distancing ourselves, whether you're at work or having a meal out or playing, as you say, and hygiene and making sure we're doing all those, all the sanitation efforts and disinfecting and masking up. All those things add up and they get us to a better place sooner for however long that we find ourselves dealing with COVID-19. And as you say, going into the fall with the flu, you have burned into my brain that we had on average 5 years, 154 deaths on average with the flu, and see where we are right now. So we're anticipating where we're going to be, but we're managing what we can today. And to that point, as we remain in 4.5, Elkhart County will remain in stage 4. We're working with them. We spent a lot of time kind of hand in glove, arriving at these decisions with our local leaders. We'll also be updating the executive order that I signed will update the 250. If you're having an event anywhere in the state of Indiana and you've got over 250 people there, we're going to be requiring that you work with your local health department to get approval of that plan. And so as we see festivals and fairs and different events that are drawing in larger numbers, I happened to attend a lunch down in Vanderburgh County. And when they couldn't physically distance appropriately, so there are very few people at one table and the tables were all scattered out in an enormous room. But when they got over that limit, folks were in a different room. And so again, just like the Children's Museum, the largest children's museum in the country, I might add, it can be done, but it's going to take a lot of work on both of our parts. And what we're really appreciative of is this local, not just cooperation, but the collaboration that is occurring. And as we go into the school year, local health departments, local schools, state government, critically important on how this all unfolds as we go through it together. And so this weekend, you'll note that there will be some updates in terms of not just the capacity levels will stay the same, but how we approve events is going to have that local component as we work our way into the fall. Having said that, I'd now like to call up Jacob Sipe from Housing, and you're going to just, if you could, Jay, give us an update on all the applications for rental assistance since you rolled that out just days ago.
Okay. Well, thank you, Governor Holcomb, and thank you for your leadership in promoting housing stability across our state. We've announced $25 million from the CARES Act to provide assistance to renters in 91 counties throughout Indiana through the Indiana Housing Community Development Authority. In Marion County, they have launched their own rental assistance program with some of their own CARES Act funding. So let me just give an update on kind of where we are with the rental assistance program. We opened the portal on Monday, July 13th at 9 a.m. Eastern time. And within the first 48 hours, we have received over 11,000 application from Hoosier renters from those 91 counties. They were applying online from indianahousingnow.org. And also those applications are available in Spanish. In Marion County, the application portal is at indyrent.org. Just a reminder, the assistance that we're providing is a maximum of $2,000 per household. And that's in any combination of past due rent, late payments, or ongoing rent payments up to $500 per month. And those first payments with the applications that we have, we're expecting to begin going out the first week in August. So renters that do have a decrease in their income and are struggling to make the rent payments, they can continue to apply online at indianahousingnow.org. And individuals that are unable to complete the application online or need assistance with another language, they can call 1-844-463-7468.
Thank you, Jake. And with that, Rachel, we'll just dive right into the Q&A portion.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. My questions are for Dr. Box. I'm curious, when you announced that partnership about a month ago with Lilly and the Indiana Hospital Association, you said that the state had spent $60 million for a bulk order of reagents to help speed up that test processing. I'm curious if the state received that order, and if so, why is test processing why is there still such a lag? I know you mentioned the national volume being an issue, but the point of that was to keep the testing in state. And then if you could address why there are only 35 OptumServe testing sites when there should be 50.
Yes, we did not receive that order. There is a purchase order out for that. We expected to receive it, but that has been delayed. And the regular shipments that we have been getting from the federal government, even before that as a state, have been decreased in the amount that we've been getting. There are 35 operating Optum sites today. Some of them are closed because they were existing in sites where they were in schools, and schools are now getting back to opening the schools and getting ready for kids to come back. Some of them have been in sites where it has been too excessively hot. Some of them are in sites where we have been working with the local communities because they have requested that they go to a different place, but have not yet identified that site.
Angelica Robinson, Wayne TV.
Good afternoon, Angelica.
Good afternoon. I understand that you've been working with governors from neighboring states throughout this whole pandemic. Michigan residents, they're required to wear masks or face a pretty steep fine. Also, people in high-risk areas in Ohio are required to wear masks. Are you considering making this, wearing masks a requirement for the state rather than a recommendation?
And right now we're still in the posture of working with local communities. I mean, we're working with mayors and county commissioners on a day in, day out basis. We've had a number of local leaders in their counties. If you look at the number of the positivity rates in different counties and the new cases that are cropping up in different counties, Vanderbilt County now has a mask mandate, Evansville, West Lafayette does, Elkhart, LaGrange. And so in
St. Joseph County.
St. Joe, yeah. So in consultation with the state and local leaders, we're not looking at the one size fits all approach right now. I won't rule it out long term, but we're looking county by county. We're also looking at in the days ahead, providing further access to metrics that would help guide people to the decision in their local community. But we're in a state where the numbers could be very different county by county, even region by region. So we're comfortable where we are right now, working with local leaders. And by the way, and you're right, I do talk to my gubernatorial cohorts regularly. And one thing that has become crystal clear in my mind is to make sure that we have those good local we used to refer to them as home rule, but those good local relationships in place for the education on the ground, including the education from the state, but the education on the ground, and then the encouragement / enforcement to actually make sure it's happening. And so this is a partnership, and we'll continue to stay on this road. However, having said that, if we find ourselves in a situation where our numbers start to reflect a Florida or a Texas or a, that gets up into that range, then yeah, we might. But to date, we've tried to set the tone here in this building. We have a mandate for state employees. We put up, in our BMV branches. So we're trying to show, again, just like the Children's Museum, that we can do this and we need to do it. And that's how we'll get through it.
Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Afternoon, Governor. I have a couple questions. The first I want to ask about is schools. What metrics should school leaders be following to decide if they reopen or close down later? And is to ask you to get more involved on a statewide level with schools, particularly perhaps about a mask wearing mandate? Are you considering getting more involved in those sorts of decisions? And then I'll have a follow-up too.
Yes, I am. And you might want to follow up on this too. We were both in a meeting with ISTA yesterday. You've been in perpetual meetings with schools. They're probably all blurring together, rural, urban, suburban, Southern Indiana later today. But yes, Brandon, we will consider that. I appreciated their concerns. They were very thoughtful. Obviously, they and others have been working on this very topic for 4 months now. We knew this day was coming. We've all been working on the proper, not just guidance, you said further guidance, but guidance and protocols that they're in place so that folks are aware of the community spread in their area. What I just said, what's happening in southeastern Indiana may be different than north central Indiana, and is. And so knowing the rates in your area, there's certainly a factor. Knowing what happens if there is a positive case in the school, knowing the logistics or the actual physical setup of the school, knowing that they have not just the guidance and the protocols in place, but then, as you mentioned, the access to the resources to make sure that the building itself is a healthy building. The building is sanitized and disinfected, and the seats are properly placed. The students are properly placed, the movement in the hallways, all these things factor in. And then those partnerships with the school nurses, with the local health department, with the state department. I mean, it just underscores that, our intent has always been to get back to in-school instruction when it's safe and where it's safe. And so there is, I completely understand this. I hear from folks across the spectrum. There is a balance maybe of eagerness on behalf of students and parents and teachers, the very teachers that were driving by students' homes and waving when they were virtually being instructed. There's an eagerness to get back together, and there's some anxiety about getting back together because of everything that's happening around us. So we have been in the Department of Education, our office, the Department of Health, FSSA, Dr. Sullivan, Katie Jenner, we're all, Lori, who you just hired, a liaison with all the county health departments and nurses. And we're all in constant communication about, yes, those protocols and that guidance and making sure that there is resources. Another thing that was brought up in that meeting, and I think it was a spot on, is making sure that schools have access to the resources they need to make sure they're clean and safe for students and faculty, teachers, superintendents, et cetera, to be in those buildings. Lori, I think, will be talking more specifically about this Friday, later this week, about a similar approach that schools will be able to take part in terms of a PPE directory. There is funding streams out there, obviously funding that we've made available for schools to take advantage of. There's the CARES Act dollars, there's FEMA dollars. And so there's resources out there to make sure that you can provide confidence and comfort knowing that your facility is clean. I've droned on long enough. You want to clean
And
up anything.
provide for PPE for them. Those same funds will allow the schools to buy personal protective equipment for teachers. We have 3 million masks for students that we're going to be giving out. So really trying to pave the way to help schools get safely back in session so that they can instruct students face to face.
Yeah, and I think those masks are now real time being distributed. But you just kind of allude to a very important point, and that is just like in other walks of life and other professions, as we come back online, we're going to have to be flexible. We're going to have to be realistic. There is, yes, the crystal ball is murky, but we see what is happening in other walks. And so schools too have been preparing, as have we, to be flexible for the future and to make sure that there is, when safe, in class, in school instruction available. But there's also other options. There's the virtual option and there's the hybrid. And so we're again, it's not just rhetorical. We're literally all in this thing together, and we'll be taking it day by day. Oh, Brandon, you had a follow-up. Sorry, my answer was 20
Sorry
times
about that.
more than your question.
No, that's fine. So we're staying in stage 4.5 for a couple more weeks. The numbers, though, as Dr. Box laid out for us, many of them, some of the more critical ones, are trending in the wrong direction. At what point do we have to start reimposing restrictions that we left behind weeks ago?
You want to talk about the rates or hospitalization, et cetera, the principles?
Right. So we're looking at contact tracing where those cases are occurring. We are seeing that most of these cases are occurring in our younger individuals, the under 20 to 30 something age groups, which fortunately, as you know, they don't tend to get too sick, but now they've had time to go back and infect grandma and grandpa. And we have had some outbreaks, at least one outbreak or a couple in long-term care facilities. So consequently, that is going to add more burden to our hospital systems, and we have patients that may be hospitalized longer. As we look at it and the percent positivity ticks up, that is what really is most concerning to me as I look at it. And I do feel like it is a time for Hoosiers to decide that they are going to go back to more careful social distancing and to wear their masks and wash their hands more carefully. And again, I reiterate that those individuals that are at highest risk should remain and continue to avoid those large gatherings that are tending to occur.
Yeah, and Brandon, I would say that, we're looking at this county by county very granularly. And when you look at the new cases, something that's interesting, and it can happen anywhere. It can happen a surge can happen in Marshall County. It can happen in Cass County. It can happen in Du Bois County. It can happen and so as we track those cases, at what rate or what number are they literally at? It's interesting to us that just like at the outset, in the population dense areas, that's where we're seeing the most cases, surprise, surprise. And so when you look at, our latest numbers, Marion County still at 86, so kind of holding around that level. Elkhart 78, Lake 52, Vanderburgh County 48, St. Joe 59. So that's kind of the bulk of it. However, we're looking at what's causing numbers to tick up in Marshall County or in Du Bois County or in Warwick County and the spread there. So there's a lot of factors that go in, Brandon, to answer your question directly, but we'll consider them all before we go back to 4 or, progress to 5. But I do, just to be clear, and I said it twice deliberately, we're in stage 4.5, at least through this month.
Mark Bennett, the Terre Haute Tribune Star.
Good afternoon, Mark.
Good afternoon, Governor. I appreciate your time.
Sure.
I wondered if you could talk a little bit about what you think would be the optimum timing to make a decision on whether no excuse absentee vote by mail opportunities should be extended to all Hoosiers in the November election, and where you stand on that subject in itself.
Yeah. Optimum time would be so the public has enough time to understand their options well before the 30 days or the 28 days prior to the actual election day, when you could be voting through various other ways. And so sometime before that, I will be meeting with the Secretary of State on this issue. Where I stand is, and I am just one of those old-fashioned guys, I guess, that likes to vote in person. And I also wanted to just see with my own two eyes if it could be pulled off safely. And I voted here in Marion County, obviously, and it was. I think one thing that we should consider, if we're still in the, numerically speaking, if we're still in this scenario, we should, and if we have the ability to, and I think we can, we should have more election day options, which would help in lines, et cetera. We've proven that we had the resources. The Secretary of State, Connie Lawson, distributed the resources. We worked with her, and we've got the resources through the Homeland Security, through the Indiana National Guard, to make sure that local communities have what they need to pull those elections off. And then if there needs to be more excuses, we'll have to talk with the Secretary of State, and she's in constant communication, obviously, with the election division and the two major parties.
Emma Kate Chalkbeat.
Hello, Emma. Good afternoon.
Hi, Governor. In New York, schools, the governor has said schools can only reopen if the infection rate is below 5% using a 14-day average. Given the increasing 7-day positivity rate here, among other concerning metrics, I'm wondering, is it still safe to reopen schools, and where should Indiana draw this line? And then another question for you specifically, I'm wondering, what is your response to the Washington Township School Board, which pointed to, quote, limited specific guidance from the governor, among others, when it announced it will only offer virtual instruction when school starts?
You want to take you're
Right.
writing something about rates there?
Well, we have bounced back and forth between looking at the 7-day rate and the 14-day rate, and the 14-day rate usually tends to look a little bit better. So I kind of stick with the 7-day rate because it's showing me what's happening more recently. We have not set on a particular metric for the schools that you have to be at this in your county in order to go back to school. But certainly when we start to climb up around that 10 to 15% positivity rate, especially if that's persistent or showing signs of continuing to rise, is when we're starting to, definitely look at the things that we can do to impact that. So even between 5 and 10, we're, already working with local communities to talk about mask mandates and social distancing and canceling festivals and making sure that they are educating and continuing to get the message out and partnering with them to do that, especially to our disparate populations there, to make sure that we are reaching those individuals that we know are at highest risk. But certainly as we go further, if that rate continues to climb, it may become more of a, we strongly recommend, or, the state would like you to do X, Y, or Z. We're hoping to not have to do that, but that's something that we've been talking about and looking at very seriously.
Yeah, and I want Washington Township, I want every township in the state of Indiana. We are working together with all of our local school corps and in an effort to open safely if they can. And we'll provide this. We've provided them with the same guidance that we've provided every school corporation. And some have sent us their plans, and they're excited to come back. And